Assalamu alaikum, lovely doctors, all those who are preparing for the exam or just going through updated versions of the guidelines. Welcome to today's episode. We are discussing nice guideline number 126. We're just discussing the one of the point in the updated version that came out, that was updated in November this year. So we go to the recommendations. It's about the use of micronised vaginal progesterone. It's very crucial in the management, the clinical management of threatened miscarriage. Let's go through it. Threatened miscarriage: advise a woman with a confirmed intrauterine pregnancy with a fetal heartbeat who presents with vaginal bleeding but has no history of previous miscarriage. All right. There is heartbeat, there is vaginal bleeding, but there is no history of previous miscarriage. If her bleeding gets worse or persists beyond 14 days, she should return for further assessment. If the bleeding stops, she should start or continue routine antenatal care. Offer vaginal micronised progesterone 400 mg twice daily to women with an intrauterine pregnancy confirmed by a scan if they have vaginal bleeding and have previously had a miscarriage. So we have 3 points here now. If there is an intrauterine pregnancy that is confirmed by a scan, they have vaginal bleeding, and there is a history of previous miscarriage. ऊपर क्या पढ़ा हमने? ऊपर क्या पढ़ा था कि there is intrauterine pregnancy and there is vaginal bleeding, but there is no history of miscarriage. So the history of miscarriage here is the deciding factor. All right. So a history of miscarriage अगर है तो if a fetal heartbeat is confirmed, continue progesterone until 16 completed weeks of pregnancy. All right. So 400 mg twice daily आपने देना है अगर उसकी इंट्रायूट्राइन प्रेगनेंसी है, दैट इज़ कन्फर्म बाय स्कैन, वेजिनल ब्लीडिंग के साथ आ गई है, उसकी प्रीवियस हिस्ट्री है मिसकैरेज की, तो फिर आपने उसको वेजिनल माइक्रोनाइज्ड प्रोजेस्टेरोन देना है. और कब तक देना है? 16 completed weeks of pregnancy तक देना है. All right. So in November 2021, this was an off-label use of vaginal micronized progesterone. हम देते थे, कोई देता था, कोई नहीं देता था. It was depending on the physician's choice. और nobody was sure कि देना है कि नहीं देना है. हर एक की अपनी observation थी, clinical practice थी, response of the patients था. लेकिन बहुत सारे लोग इस वजह से they would refrain from advising it, that there is no guidance about it, whether to give it or not to give it. So now there is guidance. And the deciding factor is a history of previous miscarriage. So whenever there is an intrauterine pregnancy, according to the new guideline, there is an intrauterine pregnancy and the patient presents with vaginal bleeding, you have to give vaginal progesterone 400 mg twice daily till completed 16 weeks of pregnancy. Okay. So this is what I wanted to share, to emphasize. Actually, you must have read the new guideline, but I wanted to emphasize on this very important point. We are going to discuss this whole guideline in the upcoming episodes, and inshallah other guidelines as well. This was just a highlight feature. All right, so take care until the next episode. Bye bye.